Welcome to today's session from SVLG, addressing the public health crisis of gun violence. Questions for the event will be collated and moderated by SVLG's Lisa Gauchier, VP of Partner Success. And Irene Chavez, Senior VP and Area Manager of Kaiser Permanente, kicks things off with today's event introductions. Thank you for joining us for this important talk.
Good morning, everyone. My name's Irene Chavez, and I have the delight of addressing you this morning with the introductions of our speakers on this very important topic of public health crisis of gun violence. First is Dr. Garen Wintemute, Professor of Emergency Medicine and Head of Violence Prevention Research Program with the University of California. Our second speaker, Dr. Robert Pearl, Stanford University professor and former CEO of the Permanente Medical Group. And as far as I'm concerned, a master of the Socratic method. We also welcome moderator, Assemblymember for District 24, Marc Berman. With that, I will turn this over to Marc Berman.
That we're going to go ahead and kind of skip opening comments and dive right into the Q&A. We've got a lot of great questions from folks. And I think, I imagine the doctors can both probably cover most of what's in their intro in those questions. So let's kick it right off with the first question, which is, it's clear from your research and approach that you both see gun violence as a public health issue. Can you talk a little bit about why and what effect gun violence has on public health and the health systems?
So thanks for having me. Critical point. I go by Garen. Dr. Wintemute's the job title. So this is actually really easy. The best articulation of this point of view I've ever heard came from Dr. David Satcher just after he became head of CDC 30 years ago, when rates of violence were higher than ever before. And we've just reached that point again in the last couple of years. He said, look, if violence isn't a public health problem, then why are all these people dying from it? It's not rocket science. We've actually increased from 30,000 deaths a year, as you heard at the top of the discussion, to 45,000 deaths just in the last few years. Firearm violence is among the leading causes of death for much of the population. We'll get into the details of it later, but it passes the duck test. It has important health impacts. I'll mention just one to get us rolling. We recently did some survey research here asking people not about victimization from firearm violence, but about the everyday experience of firearm violence. Are gunshots and shootings a big problem in your neighborhood? Do you encounter sidewalk memorials in your neighborhood where people have died from violence? Do you know people who've been shot or who might shoot somebody? We had 6 of these questions, and when you added them all up, nearly 2/3 of Californians have some direct day-to-day experience of firearm violence. Doesn't matter who we are, what we look like, we have personal stake in the problem. That's a public health problem.
Can't argue with that. Robert, Dr. Pearl.
Let me build on what Garen has just said. He pointed out that there's 45,000 deaths. That's up 25% over the past 5 years. That's up 43% over the past 10 years. And I think it's important, in addition to the neighborhood violence that he alluded to point out the fact that, first of all, this is the leading cause of young children's death in the United States today. That it accounts for 4,000 deaths tied to domestic violence with people that are well known to the individual. It is now the leading cause of suicide. More than half of suicides happen with guns, and suicides are the leading cause of death from violence. So we're looking at a trend that's moving in the opposite direction, except in states like California, where we'll talk about that, I'm sure, later on. But when I became the CEO in Kaiser Permanente, we were not doing very well. And today, deaths are down 55%. So while the nation is going up, the actions that the legislature has passed, the governor has signed to address it, have allowed us to go in the opposite direction. And as Garen said, anything that kills people is public health, and anything that saves lives is also public health. And that's what we're talking about today when we look at gun violence.
Absolutely. And before, I'm sure later on we'll dive a little more into what we're doing here in California, but Congress just, really, it was very exciting that they passed a package of gun reforms that weren't as strong as I'm sure all of us wanted, but that were better than nothing. And the president recently signed this into law. Does your research give us a sense of what impact this might have on firearm injury or risk of firearm injury in the United States as a whole?
So I'll take a crack at this. Agreed, Mark. I'm taking the glass half full approach here. Yes, we could have asked for more. We didn't. We wouldn't have gotten more, and we can do some with what we have. Let me just mention one provision, the one that will create incentives for states to adopt and implement what we call here gun violence restraining orders, what the rest of the world calls extreme risk protection orders, or calls inappropriately red flag laws. We've had such a policy in effect since 2016. Our group has been evaluating it since, actually before that. I helped draft the statute. We were ready for it to launch. And I'll say this. We know from work done elsewhere that when it comes to suicide prevention, the best estimates are that a life is saved for every 10 to 20 of these orders that are issued to prevent suicide. And let me put that in perspective for people. So I'm a clinician, as Dr. Pearl is. If I'm faced with a usually fatal health condition and somebody says, I've got a new treatment, and every 10 to 20 times you use this treatment, you're going to save a life, not prolong, but just plain save a life, I would be jumping up and down with enthusiasm at that effective new treatment. And that's what we have here. The issue that has brought this policy to the fore at the moment is public mass shootings. Most of the time, mass shooters declare their intention in advance. There's an opportunity to do something about it. We have published here in California a series now of, there are 58 cases that we're aware of, and we're still collecting data as time goes on, in which these orders were used in an effort to prevent mass shootings. And in the first 21 of those cases, we have detailed outcome data. So for 21 cases, nobody committed a mass shooting, nobody committed suicide, nobody committed homicide. I can't prove that the orders made the difference because we don't have 21 people whose threatened mass shootings were allowed to proceed according to the wishes of the shooter. We'll never do that kind of research. But 0 for 21 is pretty good odds.
And I would say that the data is clear. The more guns that are around, the easier it is to procure them, the less background checks that are done, the more restrictions placed on blocking the sales for people who are at high risk, whether of a mass shooting or suicide, the lower the death rate. And the steps that were taken by Congress, as Garen said, were small steps, but as one of the leading elected officials yourself, you're aware that often legislation happens in a series of steps. So I'm optimistic that maybe this will be the start of a process that is there. And what I would suggest is that the focus on the people under 21, the focus on individuals who would now have to have some restraint based upon the risk factors that are there, is a good, small, but a good first step. And we'll have to see what comes out of that. And of course, we'll have to see what comes in the midterm and then the presidential following that.
And you alluded to people under 21, and we know that both the shooters in Buffalo and Uvalde were 18. And I agree. Politics is the art of the practical. And hopefully just people coming together, Democrats, Republicans in Congress, particularly in the Senate, coming together and finding agreement on something will hopefully spur more agreement in the future. So I think it is a critical, hopefully, first step. Now, as with everything these days, it seems like we take one step forward, we take two steps back. For those of you who remember the Paula Abdul song back in the day, it's running through my head right now. So on the other side of the coin is the Supreme Court recently issued a ruling broadly expanding the right to carry a concealed weapon, which is something that we restrict as much as reasonably possible in California, and now we have to revisit our laws in California. A colleague in the Senate introduced a bill on that last week. Does the research give us an indication of what this Supreme Court decision might mean for firearm violence in our country?
So let's remember that the decision upheld, or I'll stick with upheld. There's debate about whether it's created or upheld a right to carry a handgun outside the home in New York. And it's not at all certain what the effects of that are going to be in other states. Clearly, California legislators, the governor's office, the Department of Justice are all looking at ways to retool to withstand the challenges that will come if that retooling doesn't happen. But California requires a permit to carry. The decision made it clear that, as Heller and McDonald did beforehand, that the Second Amendment right is not absolute. It is subject to reasonable restrictions. I suspect that reasonable restrictions will be a little bit redefined in California, but we might well continue to require demonstration of competence under stressful conditions, et cetera. I'll mention a study we did some time ago here. I'll be very brief. There was a rogue police chief here in Sacramento County, where I am, who began giving permits out to anybody who asked. He created, in essence, a shall issue city in a may issue state. And we looked at the people who got permits from him and compared their criminal activity before and after to that of people who got permits in the rest of the state. And what we learned was that even here in California, with that experiment, which was made illegal by the legislature, loosening restrictions on permits leads to an increase in risk that permit holders will commit violence. So absent very careful attention on our part and other states, I think we are likely to see an increase in violence stemming from this decision, which is what policy research has said about the variations on CCW policy up to this point.
I have more fear, not about the specific decision, because like we said earlier, it is I don't call it a small step, but it's one state and it's specific to concealed weapons. It's not related to some of the bigger pieces, but to have it come out within 24 hours of the same abortion ruling, on the opposite side, in essence, what one said states can't regulate and one said the states could regulate. My big worry is that we're at the start of what will be a national legal shift in restrictions. And as the restrictions get lifted broadly, and people and other states will take this as an indication that they can pass absurd legislation, we may see the Supreme Court seeing that, and the 45,000 deaths a year could easily double over the next few years if something is not done. Again, I agree with Garen that we have in California is a very different situation, whether it will hold or not. Mark, you probably know more about it than I do as an attorney, but I would say that nationally, the risk that we're going to see ever eroding of restrictions on carrying a gun and ever stronger restrictions on women having control over their body, that to me is a terrifying 1-2 punch that our nation has just received.
I agree with you 100%. So I can't take credit for it, but I saw somebody say that, the Supreme Court said that life begins at conception and it ends at mass shooting. And that's a very terrifying way to kind of consider what they've done. But I agree that I am very, very worried that this is just, the beginning of things to come. Dr. Pearl, you were not only a gun violence researcher, but you were also CEO of Silicon Valley Leadership Group member company Kaiser. And Kaiser has now started research into gun violence. Gun violence is seen by many as a political issue, not an easy issue for large corporate entities to wade into. What do you think goes into a decision like that for a CEO or for a company, especially for a hospital, to say, no, this is something that is important to us and we need to engage on it?
Well, I'm very proud of Kaiser Permanente's long history of being on the right side of social issues and never backing down when an opportunity exists to save lives. And I think this is another example of the $2 million that have been put towards this task, I think are going to be essential. We may get into this, believe it or not, or for listeners, you know this already, Mark, but that the Congress has restricted in 1996 the ability of the CDC to do this kind of research, to understand the consequences of gun violence, to be able to advise on appropriate health policy, and that still sits in place today. There has been a little bit of loosening about the use of dollars, but still the CDC can't do the work that needs to happen. And so I'm proud that Kaiser Permanente will be leading the way, coming up with data. But both Garen and I have pretty good gut sense of a lot of areas, but as scientists, it's nice to have a research study and particular data. And I would assume, Mark, that as a legislator, it's nice when you have specific data and information you can bring to the floor and get your colleagues to be able to vote in agreement with what the data indicates and what's best for the saving of human lives.
It's critical, especially for colleagues who maybe want to find a reason not to support those efforts. You confront them with quantitative data, and they can't kind of muddle their way around that to get to know, which might be where they're where they want to go, when we can confront them with real data. So I appreciate that. Dr. Wintemute, Garen, you helped inform my legislation 3 or 4 years ago, I think 2019, I believe, to help doctors inform patients about the risks of firearms and firearm violence. Can you talk a little bit about how that work is going?
I would be happy to, and thank you again for the legislation, which I will say, to make a larger point, is an example of just exactly the kind of partnership that Dr. Pearl was just talking about, where the evidence comes to policymakers who say, I can put this into action, and they do. It's part of why California is the success that we will discuss. So that appropriation has created a health professional education program that sits right alongside our research center. The same people work on both sides of that fence. And its job is to translate the research evidence specifically into information that will help health professionals understand the issue, so that they don't feel, I can't ask these questions of my patients because I don't know the topic. But the very specifics of how to ask the questions and what to do with the answers, and how to make this a partnership conversation and not something adversarial, what to do in a real crisis when there's a gun at home and somebody might be dead in 24 hours and you've got to pick up the phone. This effort is called the Bullet Points Project, and people can Google and find the website. It has served as a model for programs in several other states. We are broadening our focus and taking on nurses and paramedics and mental health professionals, so the health professions very broadly. And we expect that program is going to continue beyond the original appropriation, because the need for it is clearly there. And the research side of the house is generating new information for the program to share with professionals and the public.
Well, I thank you for that, Garen, and I'm so grateful for the work that you and your colleagues are doing. And that's one of the, I've been pretty successful at getting bills passed into law, getting budget appropriations, but that effort is one of the ones I'm most proud of. So really appreciate all that you and your colleagues are doing. We see a lot of headlines about mass shootings. And there's a reason for that. But both of you, I think both of you alluded to this in your answer to the first question. Can we talk a little bit more about research on guns in the home and what effect that has on firearm use in incidents of domestic violence, of suicide, and other outcomes that don't maybe get as much attention as the mass shootings do?
So I'm going to briefly mention some studies that have come from California. General comment to the audience. Much of the work that's done here makes use of data that are provided, more partnership, provided to researchers by the State Department of Justice and the State Department of Public Health. These data simply are not collected in most other states, and in the few where they are collected, they're not made available for research. So we have produced a body of work that can't be done anywhere else. And 3 recent studies will exemplify that. They speak to the risk of having guns in the home. It is a myth that bringing a gun into the home makes the home a safer place. The evidence is getting stronger all the time. I am collaborating with a group actually at Stanford using the sorts of data that I've described that has found the following things. For the person who brings the gun into the home, the new gun owner, risk of suicide goes up 1,000, excuse me, I'm sorry, 100 times, 10,000%. I got my zeros mixed up.
Still massive. That's still massive.
100 times higher than expected. It goes down over time, but it never comes close to what it was. Risk for others in the home also goes up. Risk for people in that home who don't own a gun themselves, but live with the new gun owner, face a homicide risk that doubles, goes up by a factor of 2, and suicide among those people, the household contacts, goes up by 45%. All of this information has been published just in the last couple of years. We are still following those cohorts to see how long the risk remains elevated. But the answer to the question, does bringing a gun into my home make it a safer place, is really not up for dispute anymore, at least at the population level.
So a study published on this topic in the New England Journal of Medicine showed that your chances of dying, whether it's from a suicide or whether it's from domestic violence, is actually 3 times higher when there's a gun in the home than when there's not a gun in the home. And when you look at gun ownership, what you see is if you compare the states, the 12 states that have the highest gun ownership rates against the 12 with the lowest, you see that there's 65% more people killed in the home on average in those 12 states than you see in the 12 states where the ownership is low. As Garen said, there's no evidence that having a gun in the home is going to protect you. And as we said earlier, gun violence, most of which is in the home, is now the leading cause of death amongst young children. So there's no question that what needs to happen is to minimize that and maximize gun safety. I don't want to leave that out, because if people are going to have a gun, they might as well know how to use it well. And, I think back to when I was an intern. Gun violence to me started in the ER and ended when the patient was discharged. And I think what we fail to understand, as we have across a lot of medicine, is the power of prevention and the need to be able to talk with parents and families about gun safety, about locking up any weapon, about keeping it unloaded, about all the tools that we know or all the errors that we know that unfortunately kill innocent children. And as we, both Garen and I know, several of the national organizations have now taken a position around this, despite all the pressure on doctors and despite all the burnout, to add this on because of how important it is for physicians to be able to identify this. We need to identify people who are at risk of getting hurt in the home overall. And we need to be able to understand specifically the risk of harm, especially to children, by not having maximal gun safety in those homes in which a gun exists.
And thank you to the physicians and other medical, doctors and other medical professionals who are willing to take on that additional task when you already have so much going on. The recognition that rightfully so, that you can play a huge role in trying to reduce gun violence in our communities, and your willingness to step up to help with that is a huge benefit to society that we should all be very thankful for. This next question is very self-serving, and I think y'all's comments might have just given me an idea. But what should my next bill be? Are there little things or big things that we can do in California to move the needle a little more to reduce the amount of people shot or killed, or learn more about what might work? And a thought that I just had, I chair the Business and Professions Committee. I've had 2 bills this year that talk about businesses having the pamphlets of information that they give people when customers come in. One was in the cannabis space. The other, oddly, was in dogs and cats and shelters. Do we have anything like that in California, where when you go in to buy a handgun, you're given a pamphlet that provides that tells you this data, that by taking this home with you, it is going to increase the risk of homicide or suicide at home?
No, we don't.
Maybe we should.
I think it's a wonderful idea. A general comment. The prevalence of gun ownership in California is lower than in other states, and that's part of why our rates are lower. But there are lots of guns in California. There will continue to be lots of guns in California. We are not going to disarm California. Forget about it. So I think, Mark, you're right on the money. We are, to put it in a grim metaphor, stuck with harm reduction at the moment. What are the things that we can do in this climate? I think one of them would be to provide accurate information to the public. I mean, for me, the idea that having a gun in the home makes the home safer, given the increasing mountain of evidence on the opposite side, it's sort of like believing in deworming medicine and injectable disinfectant for COVID. It just doesn't fly. But I'll give you an example that I think will maybe increase your sense of optimism about what you just suggested. We did some research here a couple of years ago, a survey of the state, asking about the gun violence restraining order red flag law. And what we learned was that very few people had ever even heard of it by any of the names under which it is known. But when in the course of the survey, we gave a brief description of what the law was and how it might be used. And then we gave some scenarios, person in emotional distress, threatening harm to others, to themselves, mass shooting. And we asked, so do you think this is a good idea? Should there be that kind of restraining order mechanism? 75 to 80% of the respondents said yes. When we asked, would you yourself file the petition if need be? Same high level of support. And something I have never seen before, support was higher among gun owners than among non-owners because they understand the risk. I think we cannot give up on the possibility that, among other strategies, providing people accurate information about an important health problem will lead to better, more informed choices. In this case, about bringing a gun into the home. I think it's a great idea.
The California's success is a reflection of the legislation that you and your colleagues have passed. There's a ban on assault weapons. There is an extensive background check process. There's a 10-day delay between the person applying for the gun and being able to take it. And often in that 10-day time period, something can be done. The mental health issue, if there's one, can be found. As Garen said, the online chatter that may indicate that some type of terrible event's about to happen can be found and investigated. And so it should come as no surprise that California has dramatically lower incidents of these types of violence. But if you're looking for legislation, I'll throw out an idea. If you read the papers, you'll see that Chicago is a very violent city. Not in California, obviously, Chicago, Illinois. And a lot of the violence happens out of gun violence. What people don't know, Illinois actually has pretty good legislation, but 50% of the guns used in homicide came from another state. And I think that conceivably, and I'm not even certain what exists right now, Garen yourself might know better than I do, but being able to add penalties, create restrictions in some way to stop the inflow of guns coming from elsewhere, I think conceivably would force people under the restrictions of California, and in that particular way lead to even a lower chance of a mass shooting.
Can I take that and run with it?
Yeah, please.
Just very briefly. So the interstate stuff gets us to the federal level, but here's how that could become a state proposal. There are well-defined pathways along which guns are trafficked from states with loose restrictions to states with tight. Some of them so well known that they have names. Iron Pipeline. There's a pipeline from Reno to Northern California. There's a pipeline from Phoenix and Yuma to Southern California. I've done the field work. Go to a gun show in Reno, and 30% of the cars in the parking lot have California plates. I have walked and counted. But there's a small scale off and on law enforcement effort that is specifically focused on deterring or preventing the interstate transfer from places like Reno to Northern California. I'm not the only person watching at gun shows. And if you load up a
Mhm.
bunch of prohibited stuff into the trunk of a California car, you don't make it past Nevada City. You get pulled over because somebody else has made a call. That effort could use increased support, both the Northern and the Southern California versions, because the trafficking pathways are well known. And I'll end with this. It's even enough to advertise that California enforcement is in those places. You don't even have to be there. You just have to create the impression that you are.
That makes a lot of sense. And I'll be following up with both of you about this probably in the fall. Thank you for that. I now have the pleasure of turning this over to my good friend, SVLG Vice President, East Palo Alto Vice Mayor, and Marc Berman 8024 2022 Woman of the Year, Lisa Gaucher, who's gonna moderate the open Q&A portion of today's event. Lisa, take it away.
Thank you so much, Mark, and to both doctors. Thank you for that information. It makes so much sense. As a vice mayor in the city of East Palo Alto, we live by a shot spotter system that alerts us and let us know when there's a gun, and it can tell the difference between fireworks and guns as well. So something that's really important to me, most recently we had a shooting in a park and kids were all around in the park. It is terrifying that what has happened to these children. When you think about the health crisis, they will be dealing with this for quite a while. I'm going to ask some questions that some of our members have. And one question is in the chat, and it has to do, if you can explain the role of gun insurance and safety training. And I don't know who wants to take that first. And Assemblyman, if you want to jump in when you want to.
Brief safety training probably does not make a lot of difference. There have been a couple of controlled studies. This has not been looked at recently. And I think it needs to be again before we get definitive. But they came to the conclusion that a 2-hour, 3-hour course probably is not sufficient. That the training to understand not so much how, but when to use a firearm, when it's dark and your pulse is about 140 and you don't know friend from foe, that sort of situation, that takes time and training, the sorts of stuff that law enforcement officers and soldiers go through, to be honest. Insurance, jury still out. It's not been tried on a large scale ever. San Jose is trying it right now. There's a brand new proposal before the state legislature that Senator Nancy Skinner is lead authoring to implement this on a state level. I have not seen any studies. I'm not an economist, but I've asked economists who work in this field, who, to be honest, have come down on both sides. So states being the laboratories of democracy, I expect we're going to have an opportunity to find out if it works. If our group is in the process of designing an evaluation to put into place if there's a chance to use it.
Thank you. Dr. Pearl, would you
Lisa,
like to? Yes.
Oh, if I can just jump in, I apologize. My staff is asking me to break away to go present a bill in a Senate committee before noon. But thank you, everybody, so much. Thank you, Garen. Thank you, Robert. Thank you, SVLG. One quick thing to follow up on that Lisa said. A couple of weeks ago, I had a chance to welcome a group of fourth graders into the Capitol. And I love it when fourth graders come to the Capitol and I get to greet them and talk with them about what I do. And I asked them, you know, what if you were an assembly member, what bill would you introduce? What issue would you try to address? I spoke to 2 classes that morning. In the first class, the first issue they brought up was reducing the amount of people who get killed by guns. Second class, the third idea they brought up was trying to find more ways to reduce the amount of people who get killed by guns, 10 and 11-year-olds. So, you know, this, like Lisa said, this is having such a big impact on our youth. And that drives me, and I know that drives a lot of us to try to reduce the amount of violence that we have in our communities. So thank you, everybody. Apologize for running off early, but good to see everyone.
Thank you so much for your time.
Definitely.
Talk to you soon. So, Dr. Pearl, I don't know if you wanted to address that or talk about that issue when it comes to insurance or the training.
I think, as Garen said, we don't have the data that we really need to be able to answer this question. It's my personal view that owning a gun, even though there's the Second Amendment that exists, it's still a privilege. It's not an absolute right. It's a right that you have to earn by being certain that it's going to have the least damage, and I'll say the greatest good. And anything that we do to increase the size of that hurdle is going to have a positive influence. So I think taking people who are already very careful and worried parents about childhood safety, as Garen said, a 2-hour program, it may not change very much about them, but to have an extensive program that people have to go through to demonstrate knowledge and demonstrate an understanding of the risk that is there, I can't imagine that it would not also diminish some of the gun purchases. You know, I think throughout this conversation, we have to understand, you have the mass shootings, you have the murders and homicides that exist, but you have these other pieces as well. Ones for which there is no bad guy, or if there's a bad guy, that's not why the person has the gun. Some of that's inside domestic violence, where there is a bad guy, but it's not the person having the gun to protect yourself. It's actually the person having the gun who's at the forefront of that all. And then it's in the big suicide risk. And there are mental health things that we have to do beyond what we can talk about today in the healthcare system to make sure it's available, because there are people at personal risk to themselves. But these kinds of programs, these kinds of classes create this opportunity to identify the individuals, to make it less likely they're going to, in an impulsive way, go out and obtain a gun. And so I'm a big supporter that the more things we can do, the better, and that the cost of gun violence is so massive that from a cost-benefit analysis, it's always going to be beneficial.
Thank you so much. I want to be mindful of the time. I knew an hour would not be enough time. It's 11:50, gives us 10 more minutes. I have a few questions to ask, but I see that Irene has her hand raised. Let's take that question and let's see how many questions we can get through within this limited amount of time.
Thank you, Lisa. Question for both of the physicians. Speak to the impact that gun violence has upon the physicians and the nurses and the staff in the emergency rooms as they care for the victims, as well as the additional impact it has to the closing of the ED for that period, and what that means for other people who need emergency services.
So I'm going to declare a ground rule, lightning round. We're going to be really quick here. A couple of years ago, the NRA tweeted that doctors shouldn't be involved in this issue, that we were out of our lane. And there followed a flood of blood-soaked trauma rooms onto social media. Like, are you kidding me? The deaths, the trauma is preventable, is part of what makes it so tough. The knowledge that if we had better policies, this dead young person wouldn't be on a gurney in front of me, they'd be out with their friends. One of the most moving pieces of writing I've ever seen on this issue is an op-ed in the New York Times about gun violence, how to tell a mother her child is dead. I ask people to think about having that conversation as part of your regular workday on a regular basis, and consider what the impact would be on you. That's the impact that it has on health professionals. We get trained, but we're people first.
Thank you.
If you look at TV, you tend to think that when a bullet is shot at a human being, that it's almost like an arrow. It has this little narrow path that goes through the person, rarely causing any harm, unless the shooter is a genius and knows exactly where the pulmonary artery is. That's not what happens at all, particularly when you get to high velocity. So it's a velocity squared problem. And the high velocity rifles cause spinning of the bullet, fragmentation of the bullet, and what's called cavitation. And the destruction is massive, often impossible to stop in time because of the number of structures that have been completely destroyed as a result of this high velocity implosion that happens inside the human body. And as a surgeon, as a physician, it's just tragic to have a patient who's there dying in your hands because the damage is so great that no matter what you do and your team does, you can't save the individual. And I think also, to add on to what Garen said, we just went through COVID, where patients couldn't get into an ER because it was filled. They couldn't get into an operating room because the operating room had closed down and there were not enough people that are there. We saw so many tragedies coming out of a chronic disease. And from my view, gun violence is a chronic disease. It's growing across time, and the impact and danger to the community is getting greater. And we have to recognize what it is and recognize the rights of those people who are not involved in gun ownership, because the violence that is created is harming them and taking away from their own lives, their wellness, and increasing the risk that they too might die unnecessarily.
Thank you. Well, another question from our member: with so much information unavailable to gun violence researchers, what can reasonably be done to close the firearms data gap? Is it more of a funding issue or more of an access issue?
It's a little of both. Here in California, it's not a big problem. Federally, both funding and access. And it's going to take a while because Congress has enacted statutes making it illegal, a federal crime, to share the information, making it a federal crime even to compile the information into a shareable format. That's how systematic the effort to retard research has been. Here in California, as I've mentioned before, access, again, recently there was a temporary problem, is good. The one thing that we've been missing as a non-Kaiser person is access to clinical data on large samples of patients. And Kaiser is creating a new center. We're in conversation about a partnership. So I think the ability to conduct large-scale clinical studies, randomized trials of education, for example, the sort of thing that Assemblymember Berman was talking about with good information, is going to become possible. So the answer is quite different if we're talking about here or in other states or nationwide.
Thank you.
I'll second that. Kaiser Permanente has the data across the United States. We've taken care of 11,000 gunshot victims, and making that data available, I think, would be quite helpful to be able to allow the public just to understand the magnitude of the problem that exists. And as I say, it exists in inner cities, it exists in rural areas, it exists in the suburbs, it exists everywhere, slightly different by geography, but the endpoint, which is patients dying, is common, whether it's from a homicide, whether it's from a domestic violence incident, whether it's from a gun accident, or whether it's from an individual suicide.
Thank you so much. We're going to turn and ask our CEO, Ahmad Thomas, to ask the last question.
Last question. All right. Well, to Irene, Dr. Pearl, Dr. Wintemute, such a fascinating conversation. I think the fact that you're in front of business leaders in Silicon Valley, starting with a small group discussion, I hope the dialogue can continue, shows that the business community looks at the stakeholders we're serving and issues like this, I think, very differently, just given the crises we faced over the past few years in this country. My question speaks to culture. And the question is around when you talk to individuals who don't see eye to eye with you around this issue related to guns, what have you found to be convincing to help get to a well-reasoned place? I come from a rural area, got a lot of family in the deep South. I have no issue with hunting and the sportsmanship, but there's often a gap of reasonableness. And I'd like to know how you all successfully close that gap in your conversations with individuals.
I have that conversation with patients all the time. I'm an ER doc. And I do intervention on this in the emergency department. The keys are this: to know the topic. I know guns. I grew up around them. I used to teach riflery. I was a member of the Rifle and Pistol Club here. So I don't have that cognitive deficit, but anybody can take care of that cognitive deficit. Knowledge deficit, I should have said. But the other is to respect the difference, to understand that whether we agree with them or not, the gun owners have in their minds valid reasons for having those firearms. And to question the validity in a confrontational sort of way is to shut down the conversation. I start with, what do we have in common? We want you to be safe at home. And in the emergency department, it's often, I've asked some questions that suggest to me the risk for violence in the home is elevated. And I will say those words out loud, whether it's alcohol or depression, or they're here because of a violent injury. I establish a mutual understanding that safety is at risk here in the room as we are talking, is at issue. And I'll say, under such circumstances, I ask some more questions about safety and risk. I ask about guns and a few other things. So are there any guns at home or something like that? So I've established credibility, I've established relevance, and I just used the word guns about 3 seconds before I asked the question, which lets that initial defensive mechanism come and go and lets them hear the question. And then finally, if they'll engage with me, great. My objective is to have the conversation. If I can get them to change behavior, that's even better, but at least start the conversation. And if they say, forget it, doc, you and I are not talking about this, that's pretty much the end of the conversation, unless it's an emergency. I'm going to respect their position.
I would say what's most important from, as you say, a cultural perspective when people disagree is to start with, what do we agree on? Let's not talk about what we don't agree on. I think we all agree on gun safety. I think we all don't want to see anyone die unnecessarily. So if that's what we commonly agree upon, that to me leads to data. Okay, what questions can we look at? How can we pull that data out if we both want to have maximal gun safety and the fewest unexpected and tragic deaths? And I think coming out of that data, if we could all agree on how to obtain it, we can come to better common understanding about what to do next. But I also want to throw a last idea out to the business community, which is that our nation right now is sitting in an economic challenging time with inflation soaring and with a lot of pressure likely to come onto businesses. And I think it's going to be an imperative to businesses to look at ways to reduce healthcare expenditures, because so far they have not gone up very far this year because the insurance programs have not been renewed. They are going to go up in the same way, and they're going to make American businesses less and less globally competitive. And so I would say that something like gun safety is such an important part that businesses should see it not just as a societal and social imperative, but as an economic and financial and competitive one. And thank you so much, therefore, for hosting this for the broader business community.
Thank you so much. I do apologize if we didn't get to all of the questions. I want to thank Dr. Wintemute, Dr. Pearl, and Irene for your work, and the Assemblymember for being here today. This conversation will continue. We clearly couldn't get through this in an hour. It's a conversation that needs to continue to happen. Looking at addressing public health as a crisis for gun violence is something that is important. Please stay tuned. We will continue to have this discussion. But for now, on behalf of our CEO, Ahmad Thomas, and my colleagues at the Silicon Valley Leadership Group, thank you for your time, and we hope to see you at a future event.